have a word of prayer. Shall we close our eyes as we pray? Our gracious Heavenly Father, we want to thank you for being with us. We want to thank you for the ministry of the Holy Spirit. As we start this program, we invite you, Father, that you lead us. We invite you that you touch everyone who listens to this presentation. It is our prayer, Father, that it may have an impact in families. It is our prayer, Father God, that it may empower all families so that we are ready to face tomorrow and we are safe from this virus. This we ask in Jesus' name, amen.
Amen.
Thank you very much. Today we have presenters, our guests from around Eastern Cape. The first guest is Sister Jele. Sister Jele comes from Penuel SDA Church. Penuel SDA Church is from East London Inland District. Sister Jele is a qualified professional nurse working in the provincial office, working as a program manager. She will be sharing some tips with us and informing us regarding this COVID-19. As I've already mentioned, that she is a qualified nurse. This is her field. Our second guest is Sister Nomakabiso Gomo. Sister Nomakabiso Gomo comes from Bishop SDA Church. Bishop SDA Church is in King Williamstown District. Sister Nomakabiso Gomo is an independent social worker. Secondly, she is a wellness and training consultant. As you have heard, also, she will speak in this topic with authority. This is her field. The third guest is Dr. Kwinana. Dr. Kwinana comes from Kwelecha SDA Church. Kwelecha SDA Church is from East London Coastal District. He is practicing as a family medical doctor in the East London area. His passion is evangelism and health ministries. He's a father of 3 adult daughters, and he is a family man, a married man. Those are our presenters today. They will be talking on a topic, physiological and psychological effects of COVID-19 and a survival kit. They will be talking on those, on that topic, and our first presenter is Sister Jele. Sister Jele, over to you.
Thank you, Mfundis. Greetings in the wonderful name of our Lord and Savior, Jesus Christ, to the Cape Conference and all the Seventh-day Adventist family and other denominations that are listening. I am Busisiwe Jele, as Mfundis has mentioned. I have survived, and I can safely say I'm a survivor of coronavirus. Let me just take you through my history. When the coronavirus started, as he has mentioned, we are health workers. We normally discuss health issues with the family. We sat down with the kids, explained what coronavirus is, what we are supposed to be doing differently with the kids. And in the house, we've got a 4-year-old, so we have to explain things to them. So we sat down with them and even had a hand sanitizer put next to the door. As you enter the door, you sanitize. So they were excited about those things. Washing hands more often. The 4-year-old was even now allowed to go to the sink and wash hands as often as he can, which was something was previously not permitted to do. So we have also limited our movements as we were advised. We were staying at home. We were not allowing anyone to visit us. At the start of the lockdown, some of our brethren were trying to fellowship in small groups in their homes, and were even those ones that would be discouraging such acts on the WhatsApp groups. And I think they understood ultimately. Now, as the time went by, I then joined the provincial COVID response team for the department. So we were working in streams, advising the districts and supporting the districts, trying to make sure that we control the spread. And unfortunately, we were emailed to say that some of our colleagues have tested positive for COVID-19. Let us go and test. Now, I felt I am 100% healthy. There's no need for me to go and do this test. I really did not feel like going to do the test at all. I did not want to go to do that, but I felt, let me comply. So I went to get the test on the 15th of May, and it came back the next day because they were marked urgent. It came back the next day, it was positive. When we got the results, I remember it was the Sabbath on a Saturday. We were just preparing to listen to the sermon. My heart sank, everything stopped. So I had to call my husband aside to the room and tell them this phone call was about this result. And fortunately for us, we had, after I had done the test on the previous day, we sat down and discussed possibilities and feasibilities as to what we would do in the case of a result coming back positive. And there was a lot of concern, a lot of worry, because my father-in-law, we have been transporting him. He goes for a dialysis. So whenever I go to work in the morning, I would drop him off at Island and private. You know, he's in the same car now. He was the one I was most concerned about. A 70-year-old diabetic on dialysis, that's high risk. So I was very much worried about him, even though I was feeling fine and with no symptoms at all. So it was very stressful. We had to decide on how we're going to explain this to the kids. We sat them down, explained it to them. In the house, there's a 21-year-old, an 11-year-old, and a 4-year-old. And they were very scared. They were very scared. You could see the manner in which they were complying in terms of washing hands, sanitizing, and staying at home and obeying the rules, that they are scared of coronavirus. And unfortunately, on the news, the numbers were always married to the number of deaths. So in their minds, corona was related to deaths. So what is going to happen with our mom now? Is she going to die? There were a lot of questions. But with that, provision was made that I be isolated at a BNB together with my colleagues. But I refused because I do have the means, and I want to explain and emphasize this. The only reason I refused was because I do have the means. What are the means? The means are, I've got an ensuite, a separate ensuite in the house with a separate toilet, meaning I would be able to lock the room and use my separate toilet, bathroom, shower, and the room where no one will be able to access. Now, this is not always possible for everyone. Not everyone would be able to refuse isolation because they've got the means. So I also want to encourage that in the event that you are positive and you have to be isolated, please agree to save your family. Fortunately, when they were tested, everyone was negative, including my father-in-law. Now, the the strain comes from having to be alone in the house and having a 4-year-old that understands that you are not well. But he was complaining, even saying, why is mom, because whenever he comes to the door is locked. Why is mom being unfair? She's locking us out. No, it's not fair. She must stop doing this. And it did not feel nice. You want to hug them. You want to talk to, you want to show them that I'm well. Look, I'm fine. I'm not dying. But you can't, you have to isolate. That was very stressful. The days went by, we even had mask now because also the helper had to be safe, but fortunately she also tested negative. Now, as the time went by, I'm a person with an unknown dyspnea. A dyspnea that doctors do not, since 2012, they are still investigating. Now, it has always been our worry because when we are talking about corona, we are talking about comorbidities. And what happens if you are asthmatic? What happens if you are diabetic? So we're always worried about this dyspnea of mine. Dyspnea is shortness of breath. I then developed shortness of breath at around day 11, which we believed that it's not corona related, but you cannot separate when you already have a diagnosis. Shortness of breath, chest pains, that were like closing in. I could not breathe. It was painful. Now it means that I have to move. I have to get help. That proved to be a challenge. I don't want to imagine how much more for someone else. We went to St. Dominic's. The casualty was full. The hospital was full. There were no beds. If you remember in Mary and Joseph's story where they were looking for a room for Mary just to give birth, it reminded me of that. But all the whole time I was telling my husband that do not worry, I'm going to be fine. Do not worry, I'm not going to die. God is not a liar. He said that we must honor Exodus 20 verse 12. We must honor our parents because then we will live. So I kept on reminding him about that. And I told him that I maybe have corona just so that it's a means to strengthen other people. So do not fear. But he was obviously, because I can't breathe, it's painful. So we went there, the beds were full. We were told to wait outside in the car until there's a bed. Then it was late in the afternoon. There was still no bed for us at casualty at St. Dominic's. So we had to come back home. He called Medicross, and he has to mention the corona part of it so that people are safe. Even though we think that maybe it might be my shortness of breath, but we have to so that they are careful. He meant at the mention of corona, no, sir, please do not come. Please don't come. And I'm like, where am I going to get help? We come back, we go to my GP. My GP says, wait, she must wait in the car. You come, I will give you the prescription, meaning my husband has to get in and get the prescription without me being seen. Now, what I'm trying to demonstrate from this is that healthcare workers are human beings. They are not immune to coronavirus. They are also fearful for their lives as well as their families. Later on that day, I got worse. The situation was just hopeless. This was last week. He had to call an ambulance. He called St. Dominic's again, and this nurse advised that we call an ambulance. So he called an ambulance came, fetched me, took me to life. They stabilized me there. But I said, no, I can come back home. I'm feeling better. Now I came back home. Now I'm demonstrating this because the levels are going down. People think that coronavirus is normal and people are careless. Hospitals are full. Healthcare workers are inundated with work. They are also scared. They are also becoming infected. And we are going to have car accidents, people stabbing each other, shootings. And what is going to happen with the hospital bed? It would be nice for a person not to get corona, I'm telling you. But because I'm a very strong person, faith-wise, I kept on, people were calling me very worried. I had to be the one counseling them. Guys, I'm going to be fine. This is okay. You know, God is not a liar. He said that he will be with us the whole time. And the sermons, I remember Pastor Nono, when he was preaching the other Sabbath, when he said that the devil wants to separate a person from God. And during this time, people must understand that we shouldn't be so fearful that we run away from God. We shouldn't be so despondent that we do not have faith in God. He was with me the whole time. He gave me strength, mental strength. I had it. Physically now, I am fine. I'm normal. I'm fine. But you know, the emotional component of it, it just affects you in many ways. But because God is so faithful, you know, in Isaiah 3 verse 10, he says that, he says in Isaiah 3 verse 10 that, you know, because God was with me the whole time, I did not see a need to be fearful. Even with the chest pains and the dyspnea that and the shortness of breath that I had, I was saying that I'm not going to die. This is going to be over, you know. But the one thing that is very scary is that you may have coronavirus. I may have not had maybe a chest pain, but imagine if I had infected my father-in-law and he ends up in hospital and maybe even dies because he's got his own comorbidities. Now, it's really not a nice feeling. So for us to try and adhere to what we are advised to do is really not easy. I'm talking from personal experience, but we need to try to do as much as we can to make sure that at the least you are not infected. But if you become infected, do not despair. God is there. I remember when I got the phone call that said, well, your result came back and it is positive. My heart sank, everything stopped, but then I quickly had to remind myself that I am feeling well. I was feeling well yesterday before the test. What's going to change now? My behavior has to change, otherwise I'm fine. So we need to go back to God for mental strength and for him to increase our faith through all of this. He's going to get us through. In fact, for that matter, I've been saying to friends, family, and colleagues that God would be a liar if these things were not to occur, because he said that these will be the telling of the times. And I'm so excited and happy that just like in heaven, it says that we're going to be telling each other stories. And I'm sure Miriam will be telling us about their journey. We'll also be telling them about Corona. Actually, this is what was happening while you were waiting in your graves. You know, it's nice when it's a testimony, but the problem is you do not know, should you get Corona? Are you going to be healthy and well? Are you going to survive? Are you going to land in hospital? Are you going to die? So hence we still need to be safe and adhere to the rules. But most importantly, our God said he will never leave us. And it's not Corona that's going to make him leave us. And it's not the next pandemic that's still coming that we don't even know that's going to make him leave us. He is going to be there and carry us through. And when he says that, he doesn't say that you are not going to get into fires, but he says, we in the fires, I'm going to be with you. So that's what kept me going, even when I had. And if I may share with you, today is my freedom day. It was my day 21 today. So I'm back with my family now. I can hug my kids. I can cook for them again. So it's very nice that I'm back, but it was very frustrating. I wouldn't wish this for anyone. Please, Adventists, please. Yes, we trust God. It's not that we don't trust God, that we go through trials. And God only allows those people that are strong to go through things so that we strengthen those that are weak. Thank you.
Amen. Amen. Sister Jele, thank you very much for this testimony.
Amen.
I'm sure it has opened the eyes of many, especially on the fact that COVID-19 is a reality. It's not a myth. It's a reality. It is there. It is there. We just need to be very careful. I noted in your presentation, in your testimony, you kept on saying people need to stay safe. They need to stay
Yes.
safe. Yes, we believe in God. Yes, God is powerful, but we need to play our part. We need to play our part. When the government officers advise us to wash hands frequently, we need to do that. When they advise us, when we go to public places, we need to put on a mask. We need to do that. And we are not doing the government a favor when we do that. We are doing ourselves a favor. When they ask us to keep the social distancing, the 1.5 to 2 meters, we need to keep that. It doesn't matter whether how urgent I want to get to the shop, but I need to remember that my health comes first. When I have to stay at home and leave only when it is necessary, I need to remember that stay at home, leave only when it is necessary. I think that was the message you are sending to God's people. Brothers and sisters, you've heard to Sister Jele. Sister Jele is the survivor of COVID-19. And what I like about her is that she goes all out to warn everyone about this virus, that it is real and it is very dangerous. Keep safe. Thank you very much, my sister. Thank you very much. At this time, we are going to hand over to Dr. Kwinana. Dr. Kwinana will touch on the physiological effects of corona. Probably he will go back on the metaphysics. What is this? The historical information about this virus, and then the effects and the survival kit. Maybe you won't touch on the survival kit as yet until we get to the psychological effects. Dr. Kwinana, over to you.
Okay. Thank you, Mfundisi. Thank you, everyone. Thank you, Sister Jele, for such a passionate testimony on surviving coronavirus infection. Good afternoon, everyone. I am certain that from this discussion, from this talk, you may have picked up that we talk about corona, we talk about COVID-19, we are talking about, I'll also be talking about SARS-CoV-19. You may have already heard about that. These are all synonyms of one and the same condition. Basically, this is a 2019 novel coronavirus infection. We're saying 2019 novel coronavirus because it falls in the family of viruses that we call coronaviruses. It's novel, that is, it's new, and it was discovered in 2019. So, hence we call it 2019 novel coronavirus, or in short, we will talk about COVID-19. And if you read some scientific journals or publications, you will hear them talking about SARS, Cov19, which is an acronym for Severe Acute Respiratory Syndrome that's caused by a coronavirus in 2019. In my talk, I just want to demystify and reduce the anxiety about this condition. It's said knowledge is power. I know, after Sister Jele has given us this testimony, and also what we have been hearing and reading in the social media, public media, everyone is so anxious, so full of anxiety about this condition. But once we know, you'll find that we will have less of an anxiety, and then whatever we are doing, we will be rational in what we are doing. Let me say it then from the onset that because this condition has only been with us for the past 6 months, no one can say is an expert in it. You will hear some professors saying that no one is an expert. Respiratory physicians say that no one is an expert on this condition, because indeed you can't be an expert over a period of 6 months. But I will try and share with you what we know as the medical fraternity about this condition. As I say, this condition has only been with us only for a few months. Here in South Africa, actually, it has been with us only for 3 months. And but I know it's as if it has been with us for a very long time. Let's just talk about what this virus is. This is a new virus that causes respiratory illness, ranging from common cold to an acute respiratory syndrome. Common cold, everyone knows about common cold. In winter, we'll at times you'll get a bit of a temperature, stuffy nose, bit of a cough. At times, that's what it just does. And it's not something that is, actually in some people, it doesn't even cause any symptoms. Of course, the other side of the spectrum, it can cause people to all of a sudden have an acute shortness of breath, symptoms of the respiratory system. When I'm talking about respiratory system, I'm talking about from the nose right down up to the lungs. Okay, this virus spreads from person to person. It was first identified in the first week of January 2020 during an investigation on an outbreak in Wuhan. I'm very sure now one will start saying that, where did it originate? Coronaviruses it's a large family of viruses that are causing illnesses in animals like camels, cattle, cats, and bats. Coronaviruses rarely infect people, but like SARS, that is severe acute respiratory syndrome that happened previously, and also MERS, Middle East respiratory syndrome, it can spread. These viruses can spread and be found in people. There are numerous studies then that have been reported that link this particular coronaviral infection or origin of this coronavirus to an animal market in China. And then it spread out from one city in China to other cities. And then ultimately, to the whole world and even to us in South Africa. Now, one will ask, how is it transmitted? Coronavirus is transmitted from person to person through respiratory droplets. These droplets can land on surfaces. These respiratory droplets can land on our hands. They can land on objects. That's why we suggest maintaining a safe distance from a sick person, because it spreads by respiratory droplets. Okay, I've just made up some few notes here. Okay, one will say then, why do we recommend not touching our body openings like the mouth, the eyes, and the nose with unwashed hands? Because as I say, we can have these respiratory droplets on our hands when we are sneezing, when we are coughing. And so now it will land on our hands. And if you touch somebody, you can transfer it to somebody else, and then that person touches her mouth, her face, her eyes, and then now one will get this virus in that manner. I am sure now you say, okay, tell us, doctor, what are the signs and the symptoms of COVID-19? Because we want to know. All right. As I said, it is similar to flu-like disease that are caused by other respiratory viruses. It can just be mild symptoms, flu-like symptoms, but it can spread up. Actually, it can go across to the severe respiratory illness, where you feel short of breath, where you are running a high temperature. CDC, the Center for Disease Control, they have listed a number of symptoms and signs that have been found generally across people that have been infected by COVID-19 or coronavirus. These range from dry cough, fever, that is high temperature, lento sawuthi thina ingqele, tiredness, uziva udiniwe, shortness of breath, iphika, cough, asthma, sore throat, nasal congestion, diarrhea, and vomiting in some cases. Of course, the severe cases will present or will develop pneumonia. Basically, the term pneumonia means swelling of the lungs. This condition can be fatal. Some people are lucky in that they experience no symptoms at all. They just feel a little bit unwell, but they don't have all these symptoms that I mentioned. So I will say they are indeed lucky. Now, one would ask, should people without symptoms be worried? The Center for Disease Control reports that the incubation period for COVID-19 or for corona ranges from 1 day to 14 days. What does that mean? It says from time of exposure to a time of developing symptoms, it can be anything from 1 day, but other people, they develop symptoms after 2 days, after 3 days, Others, they may not have any symptoms till 2 weeks after they came across the virus. So the World Health Organization advises that if one is sick with any of the respiratory symptoms, if anyone is sick with any flu now, stay at home. Just say, it can be that I'm having coronavirus infection. Stay at home. Clean your hands after coughing and sneezing. Cover when you are coughing and sneezing. Disinfect surfaces that you have touched with your hands. Seek medical attention in case you develop any fever, any cough, or if you have any difficulty in breathing. Seek medical attention. Now, one will say, then how do you know if it's just an ordinary flu or is it COVID? Mm-hmm. Because you heard that when I mentioned the symptoms, one will say, no, these are symptoms that at times, perhaps that have, even this week, you may have been feeling. So one will say then, how will you know that this is just an ordinary flu or else this is COVID that one is having? It's indeed difficult to tell because there is symptom overlap. That is, symptoms of flu, they overlap with the symptoms of coronavirus. As a result, your doctor, even after examining you, may not know as to whether are you having coronavirus infection or are you having flu. So the doctor or let me say the health provider will advise that let us do some tests. The test then that we do is we take a swab at the back of your mouth. We stick in a swab, a small stick that is having something like a cotton wool at the front, and then we will rub at the back of your nose or at the back of your throat. And then we will take that sample, we'll send it to the laboratory. And then they will test for us. Usually, results, the earliest nowadays takes about 2 days, except if it's an emergency. It will take about 2 days in the private laboratories, but in the state, because of the numbers of cases that they are dealing with, the results may take a bit longer to arrive. Okay, then the results will tell us as to whether have we picked up any material of coronavirus, or is it just flu viruses, or is it any other respiratory virus? How is it treated? That is a question that is now, I'm sure it's in your mind. Let me say right now, as of today, there is no proven specific medicine to prevent or treat coronavirus infection. As of today, no proven specific medicine to prevent or treat coronavirus. When we treat people that are infected, our aim is to relieve the symptoms they are presenting with, and we provide supportive care whilst the natural body defenses are taking care of the virus inside. We are providing a supportive care. If one is having a temperature, we will give you some medication to make sure that we bring down the temperature. If you are dehydrated because you have been running, you have been sweating, we give you some fluids, be it we give you fluids orally or we give you fluids by drip. If you are having pain because the body at times is sore, we give you painkillers to manage the pain. But as I say, the natural body defenses, they take care of the virus inside. I'm very sure then you are saying, yo, then I must make sure that my natural body defenses are good. Yes, that is true. It is important that we must maintain good health. Generally, even before we get coronavirus, if you are maintaining a good, healthy body, chances are that your body will be able to fight it. One usually asks, Doc, are there any antibiotics that I can take, for this, to prevent this? You must remember, coronavirus is a virus. It's not a bacteria. Antibiotics, they take care of bacteria. They don't take care of viruses. So antibiotics there are no antibiotics that we can give to prevent coronavirus infection. What about ARVs then, Doc? Can we use ARVs? ARVs, basically the ones that we are using on people that at times are having HIV. Yes, these are antiretroviral medication. But unfortunately, none of them have been proven yet to be able to fight coronavirus. What about herbs? We have been hearing about Kwinana, we have been hearing about garlic, we have been hearing about ginger and all that stuff. Can we use that to prevent coronavirus infection or to treat coronavirus infection? Up to date, there is nothing proven. There is no medicine, specific medicine that has been proven that cures or prevent coronavirus infection. Vaccines. What about vaccines? Is gonyo, is tofu? There is none that is available that has been proven yet up to date. Of course, this is a new illness. We are in the 5th month of coronavirus infection. This is information that is evolving. In 2 weeks' time, I may be coming on this platform saying that we have got something now because we are, the information is evolving. Of course, now when somebody develops the complication of coronavirus infection, if now the virus is not only limited here in the upper respiratory system, in the nose and the throat, it has gone down to the lungs, now causing what we call pneumonia. Basically, let me repeat it again. The term pneumonia means swelling of the lungs. Yes, in such cases, we need to hospitalize the patients. Again, supportive management, supportive treatment. We will hospitalize the patient, put the patient in bed so that we can observe closely the patient. If the patient is feeling short of breath, we give them oxygen just to help them so that they are able to breathe. But that oxygen is not a cure. At times, we may have to ventilate them. If you find that oxygen in blood is going down, some patients are starting to get a little bit dizzy, they start losing consciousness, and because oxygen is low in blood. And then now if we give them oxygen by nasal tongues, and we find that that is not enough, then we take them to ICU. Then we decide that, no, let's stick in a tube right down into the lungs and ventilate them. But again, this is not a cure. This is a supportive treatment whilst the body is taking care of the virus inside. We put in up drips again, just to maintain, to ensure that the patient is well hydrated. We prevent other complications that set in. People often ask, does this coronavirus infection affect only older people? As Sister Jele has given us a testimony, as you can see, she's a beautiful young lady, and it can affect anyone. There are reports that even teenagers, even young adults, they do get coronavirus infection. But what we have noted, right from China to Europe to America, and lately even here in South Africa, that older people and people with pre-existing medical conditions, they are prone to getting complications once they get coronavirus infection. What are these pre-existing medical conditions that put people at risk of developing severe complications? These are elevated blood pressure that is uncontrollable, heart disease like heart failure, lung disease like asthma, people that are smoking, that are having terrible lungs, people that have scarred lungs from previous infections like pulmonary tuberculosis. There are other medical conditions that we know that put people at risk of developing the complications like diabetes, in particular uncontrolled diabetes, cancer, and HIV, more especially when somebody is having a depressed level of immunity. So these people are more vulnerable to suffer from an infection by coronavirus. So if one is having any of these, please take care. A very interesting phenomenon has been reported. Young people, youngsters below age of 18, so many of them, they do get coronavirus, but it doesn't cause any problems in them. They are playing around. I'm very sure that you have seen even in the townships, in the villages, youngsters are playing with no masks and so on. They do get coronavirus infection, but surprisingly, they don't get disease. They don't get illness from coronavirus. Of course, there are some few exceptions. It's something that is interesting, the medical fraternity. And as I say, this is a new illness. We know little about it. We are studying. Perhaps they may be having something that makes the coronavirus infection very mild in them. Or, the adults may be having something that make them, to have the virus multiplying fast and causing all the problems. But anyway, as I say, in the coming weeks, there may be some more information that will come out. And this is the reason why the government has taken even the decision of saying that we are being unfair to our children when we don't send them to school, because they do get coronavirus, but they are well. And an interesting phenomenon too is that apparently they don't even transmit it to the adults. There is an incident or cases in Sweden that are being quoted in the medical literature. Apparently in Sweden, they didn't have a lockdown. They continued with school, they maintained the distances, the social distances, and they've been found that, look, there is no increase levels of coronavirus or increase of coronaviral complications in youngsters. And actually, even transmission of coronavirus to the adults. There is a mention of one school where 5 teachers in this school, they tested positive for coronavirus in Sweden. And it has been found that, no, actually, they got coronaviral infection from each other rather than from the learners. In the staff room, that is a danger area for our educators. At times, they'll be chatting, they'll be in big numbers in the staff room, chatting, laughing. And so if any one of them is having coronaviral infection, they will be spreading up the virus. Now we are in winter. So you may find that when it's cold, closing up the doors, closing up the windows, that environment is conducive for spread of coronavirus in that environment. So please take care. Let us keep social distance. And also, if you've got any pre-existing condition, more especially that is not well controlled or adequately controlled, you need to take care. And the elderly, 60 years and above. There is always a question, at home we have got some pets. Can pets at home spread coronavirus? Is it safe to play with my doggy, with my ginger, with my cat, and so on? There is no evidence yet that pets can spread coronavirus. But we do recommend that wash your hands after touching your pets, because there are other illnesses that one can get. In closing, how do I protect myself? One will ask. How do we protect each other? We always say, avoid contact with sick people. Avoid contact with people that are running a temperature, that are having respiratory symptoms. Avoid touching mouth with your hands. Avoid touching eyes with your hands. Avoid touching your nose. We always recommend that, try and keep your hands like this, because I know it's so easy just to take your hand to your face. Just try and avoid touching your face. Yes. Because, you may have touched a surface, you may have touched a door handle that was handled and that was touched by somebody who had been having respiratory symptoms. Wash your hands often with soap and water. Wash your hands often with soap and water. It doesn't matter whether it's cold water, but water and soap. One will say, why soap? It's because the coronavirus, it has been found that it's having a wall that is made up of fat. As we know, soap breaks down the fat. So when we use soap, we break down the coronavirus, so then it doesn't become dangerous. If there is no water or soap, it's okay to sanitize your hands with an alcohol-based sanitizer. But you don't need to buy this thing. You don't need to spend money on sanitizers. Water and just ordinary blue soap, ordinary soap that is found even at home. You can use any soap. Stay at home when sick. Stay at home when sick. But consult a health practitioner if you develop symptoms like shortness of breath. Then it is important that you must consult. Wear your mask when going out to meet people. Wear your mask, because this is good. It does help, even if to some degree, but masks, they do help. Actually, it helps so that you don't touch your nose and your mouth. On that point, the mask must not cover just the mouth. It must cover the nose also. I know some masks, they are in the neck, and no, your mask must not be in the neck. Your mask must cover your nose and your mouth. And try and avoid repeated touching of your mask once you have put it on, because we don't want one to touch infected surfaces and then you transfer that to your mouth. Again, another thing, no touch greeting. No touch greeting. We use the elbow greeting, and to keep safe. To keep safe, because again, you know, when you touch somebody's hand, we don't know, that person may have been infected, had just sneezed or what, and they may be having a coronavirus on their hands. So we also recommend keep that safe distance. You know, in some places, in some countries, they say 2 meters. In some countries, they say 1.5 meters. In some countries, they say 1 meter. But we, there's no general consensus, but we all, we just say at least the minimum. Just try and keep a minimum distance of 1 meter from another person, because there are people that are asymptomatic, that don't have symptoms, but are shedding the coronavirus. So by keeping a distance, you are making sure that you are keeping safe. Let's protect our family members by practicing, this, all these things. And in so doing, we will be protecting ourselves, and then we are protecting even our family members. And please consult when one is having symptoms. When you are symptomatic, please do consult a health practitioner. I know at work, at school, there will be some guidelines that need to be followed. When you come to work, when you come to school, let's please follow these guidelines. In so doing, we shall remain safe from coronavirus infection. In closing, let me just say that coronavirus, because it's a virus that was in the animals, now it has come to people. It finds us all not having the soldiers against it, those soldiers that are called antibodies. There are two ways that we shall get these soldiers, natural soldiers, to fight coronavirus. It's either when there is an immunization schedule, that is when we have a vaccine, which we don't have. The other way is when we get an infection. Our bodies are going to form, the soldier, the natural soldiers. Then now we have the soldiers. But it is important, I always stress this, one must not get scared of getting minor, if you have been tested positive for coronavirus, you must not think about death, because if it affects only the upper respiratory system, your nose and your throat, people, they recover after 2 weeks and they are fine. Look at Sister Jele, she's fine. But now I am certain that she does have the soldiers against the coronavirus. If she meets somebody that is having coronavirus, those soldiers, they quickly mop it, they fight it up and mop it up. So most of us, actually, they say that after almost 2 years, almost 60 to 70% of the population in the country will have had coronavirus and will be having what is called the herd immunity. So I usually say to my patients, I just wish and hope that I've already come across coronavirus. I wouldn't be scared of anyone. But anyway, whilst we don't know whether we have had coronavirus or not, we need to try and make sure that we keep safe distance, so that even if you get coronavirus, it doesn't go down to your lungs and cause pneumonia. It just remains up there in your nose and your throat, and then you soon recover and you become immune. Let me just stop there for the time being. This is I've been trying to demystify coronavirus infection. Thank you.
Thank you very much, Dr. Kwinana, for this explanation. Now, at least we know something about coronavirus. You have explained it so nicely, and it is clear. Just one point before I go on to Sister Gom. Maybe not one point, just a few points I want to put before you. The first one is this virus airborne? Can I get it from the atmosphere? I'm sure there are many people who are asking that question. Then the other point is when it happens that I notice that I have the symptoms, how do I consult my family doctor? Do I just rock in the surgery and with other people in the waiting room there? How do I go about doing that? Then the last one, I heard you mention that we need to have a strong immune system. Can you also share with us how can I strengthen my immune system? Oh no, that's not the last one. This one is the last one. I'm a preacher. Preacher always says in closing. One is the last one. This one is the last one. There is a heating up debate on smoking. Government is banning the selling of cigarette, strongly encouraging people not to smoke during this time. Can you link smoking and this virus? Can you link smoking and this virus? If you can assist us on those four areas, I'm sure the viewers have questions around those areas.
Okay. Thank you, Fundis. These are really indeed pertinent questions. And as I said initially, no one is an expert in this condition because it's still a new condition. Indeed, we think that COVID-19 is not airborne. That is, you don't find the virus floating around in the air. Let's say you get out of home, you find that you can, once you inhale air outside your home, you can pick up the coronavirus. It is spread by droplets from somebody to someone else. And these droplets, they usually fall to the ground. The force of gravity pulls them down. However, what we have noted is that they are microscopic, that is, they are very minute droplet particles from our mouth, from our nose. When we are speaking, and more especially if we raise our voice, when we are singing, when we are preaching, there are more of these small droplets. If one is having coronavirus infection, now they tend to remain in the air, suspended in the air for a longer period of time. Again, if the rooms are not well ventilated, if it's a cold day and we decide not to open the windows, not to open the doors, you find that the air is stagnant inside the room. If we are many, like if we are in a get-together session, then now we find that these particles, they are suspended in the air. So they are almost like airborne now. Then now we can pick up it, it's a recipe to pick up. But once we open the windows and we are having, cross ventilation. We open the windows of our churches, we open the doors, and we open the windows in our classrooms, we ventilate our homes, then you find that, air is fresh, and you find that those droplets, they are very dilute. And then you find that even if you get coronavirus from those small droplets, you get small amounts of it. It won't come down up to the lungs. It will just remain up in the nose. And then now your body is able to take care of it. And it just causes either those minor symptoms or no symptoms at all. And the body starts forming the antibodies. How do we consult? Do we just rock up at the doctor's room or at the clinic and just say, look, if you feel the symptoms, it's always recommended that if you are having symptoms and you think that or let me say respiratory symptoms that I've mentioned, it is a good idea just to mention before, phone up and just mention that, look, I'm having this, I am worried about this. And then your health practitioner, they will either do what they call triage, or else, other doctors, they do what we call teleconferencing. They will phone you, and then they talk to you over your phone, and then try and establish what's happening. And then they are able to make a decision what to do. They are able to even advise you so that, you don't come in at the doctors or at the health center, and then you are sitting around there in the waiting room, many of you, and then you are cross-infecting, or else you get an infection whilst you were there, and perhaps you went in for something else. How do we strengthen our immune system? This is a very good question. Nature has provided us with medicine, with nature's medicines. Exercise. Once you are exercising, you are keeping a good immune system. Once you breathe fresh air, outside you breathe fresh air, your immune system is boosted up. Sunlight, getting sunlight, it's good medicine for your immune system, for your general health. Drinking ample water, it's good for your health. We must drink water. We must drink ample water. Not just 1 cup, not just 2 cups, not just 1 liter in a day. You must make it a habit to have lots of water. 2 liters, even more of water. That keeps your body healthy. Good rest. Rest is important. You must have a good sleep. Good sleep, we tend to recommend that at least 7 to 8 hours of good sleep is important. It keeps it, it improves your immune system. Of course, making sure, I don't want to get into Sister Komo's territory, making sure that you are not emotionally stressed. There are people that are always emotionally strong, and if we are maintaining good emotional well-being, of course, faith in the Lord, having faith in the Lord, it makes you have peace of heart, makes you not to be somebody who's anxious. Trusting in the Lord, it's good. It makes you be somebody who is nice and healthy. So these are some of the ways that we can improve our immune system. Of course, what we eat, we are what we eat. Just like a car, if you put in dirty petrol, dirty oil in a car, it won't give you good performance. Same applies. It is important how we eat. Vegetarian diet, not, clogging up our bodies with lots of animal fat, that is good for our bodies. You maintain a good body. Actually, it has been found that people that are being overweight, it's another risk factor for complications with COVID-19. But if you've got a nice portable body,
Mhm.
you'll find that, your body is able to fight this condition. So exercise, portable body weight, and those are some of the ways that we will try and keep good immune system.
Mm.
Smoking. There is a question about smoking. Smoking and drinking, actually, because people that are drinking, once they open the bottle, they drink, and then all of a sudden somebody wants a share, and because now they're in a jolly mood, it's easy for them to give somebody else the bottle of dumpy, and then if subject A was having corona in his saliva and so on, can transmit it across to somebody else. But smoking, they say, again, smoking, some people, when they are picking up that cigarette and then they give it over to somebody else, they can also be transmitting, through these respiratory droplets, dissolve that they are making. But more than anything else, smoking damages the lungs. Smoking damages the lungs. I'm very sure we do have in our audience people that are perhaps that have not yet overcome this weakness of wanting a smoke. Once your lungs are damaged by tobacco smoke, you find that there may be some fibrotic tissues, that is some damaged lung tissue. So if you have got any coronaviral, in fact, you have got less reserves, and your lungs, you'll get short of breath very quickly and very easily. And of course, smoking, predisposes people, to cancers. And we have mentioned that cancer is one of the predisposing conditions, to complications. But also, as we said, smoking causes, some other lung disease like chronic obstructive airways disease. And again, you find that you have got less reserves, even if, you were having a little bit of swelling that an average person will be able to handle. If now your lungs are already diseased, with you will get very short of breath very easily. Thank you.
Thank you very much, Dr. Kwinana, for this explanation. You've answered the question, and I think everything is clear now to everyone. I've noticed when you were talking about things you can use to strengthen your immune system, you were kind of going through the New Start. There's a program by health ministries. Maybe let's encourage the health ministries leaders in local churches to go strong here so that our people may have a good immune system, And also I know there is a program coming, I think it's spearheaded by the Western region, Pastor Stander, the Stop Smoking campaign. He'll be training people on how to stop smoke. I think let us attend that training, and I'm sure there is a lot we can get from that training, and we run those campaigns to assist our communities, as the doctor has explained that smoking targets the lungs as well as the virus targets the lungs. I think it's very imperative that we run the Stop Smoking campaign and we run the teaching on New Start. Dr. Kwinana, thank you very much. Sister Jele, as a professional in the area as well, is there anything you'd like to say, to add around the coronavirus?
No, Mfundisi, Dr. Kwinana mastered it.
Amen. 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 Thank you, Sister Jele. And thank you, Dr. Kwinana. Now let's look at the, Dr. Kwinana was addressing the physiological effects and also touching on what is this virus? Where does it come from? He touched that area. Now let's cross over and look at the psychological effects, because this virus affects us even psychological. I'm sure when you were listening to Sister Jele's testimony, she alluded to that point. Let's hand over to Sister Gomo to lead us in this area. Over to you, Sister Gomo.
Good afternoon, everyone who is listening at home. Thank you, Mfonsumade, for this opportunity. Thank you, Sister Jele. Your testimony was so full of hope. It was a message of hope indeed. Thank you, Dr. Kwinana. There's a lot that we have learned from your presentation. The topic that we're handling this afternoon is quite an intense topic. And now we're going to be talking about emotions and psychological effects. I just want us to do just a little pick me up thing. Join me please at home. I'm not a singer, but I'll just sing a chorus just for us to relax and become less intense as we come to this last session of this afternoon. If you're happy and you know it, clap your hands. If you're happy and you know it, clap your hands. If you're happy and you know it and you really want to show, if you're happy and you know it, clap your hands.
Happy and you know it, clap your hands.
Oh yeah.
Thank you.
Okay.
It's a happy Sabbath, ne?
Yeah.
So we really need to just go back to that Sabbath joy mood as we listen, as we share this message, because we are here to give hope more than anything else.
Yes.
Okay, this afternoon we'll just be focusing on emotional well-being of families during these difficult times. We know that emotional well-being and psychological well-being are twins. Ne? They are so closely related. I want us to look at how emotionally balanced our families are during this time. We have already heard that this pandemic is a health pandemic, but however, we can never undermine or take lightly the psychological, the social, emotional impact that it has on us. But we're going to look at our families, because what happens is that with this pandemic, all families are at risk. We can never say when we do a risk classification that certain families are low risk, certain families are medium risk, certain families are high risk. We are all equally at risk. Therefore, we all of us, to protect our families, because fortunately, emotional well-being, it rests on our hands as families. So we need to do something, even preventing, as Dr. Kwinana has said, to prevent ourselves from being infected, we have to take steps. But when infected, then there are health professionals who will help us. Even when it comes to emotional well-being, we have a role to play. There are also professionals that we can go to when we feel that this is too much for us to handle. I want us just to first look at just the general emotions that all of us as South Africans are experiencing, all families are experiencing, before we can zoom down to specifics within the family. Because we will understand that just like in the health area, it was said that some people have underlying health conditions which makes them more at risk to this virus. Same with our emotional well-being. When the virus came, most for that matter, of families have got their own underlying emotional challenges, their own underlying psychological challenges. So now the virus comes and then it adds up on what has already been there. Okay, as I said, let's just first look at the general. There are five major emotions that are connected with COVID-19. The first one is anxiety, of which I think all of us have experienced it during this time. We are anxious about our health more than anything else. We are anxious about our financial situations because we have already heard how people have lost their jobs, how people are even at risk of losing their jobs. There are companies who are already now talking about retrenching people. The second one is uncertainty. We are all uncertain about the future. We don't know what is going to happen in 2021. We don't know where we will be as a country, and we don't know where we will be as communities, as churches, as families. There is even feelings of anger. You know, when you don't have control over something, it makes you feel so angry. We were living our lives normally, having control of what happens around us. Now comes this virus, and we don't have complete control over it. It can create some feelings of anger within us. Then there is fear of the unknown. We don't know what's going to happen. We are now in level 3. What's going to happen now? The schools are reopening. What's going to happen? People are going back to work. There's a lot going on. We don't know what is going to happen. And there's also a sense of loneliness, which we also must not take for granted or take it lightly, because for some people, that is something that they go through. You can imagine, especially when we're in the previous levels, 5 and 4, when there was so much limited restrictions, some people who are staying alone, so the sense of loneliness was heightened in that sphere. But before we go to the entire family structure, I want us to talk about children, because I feel that children are the most vulnerable when it comes to our families, and especially in the area of emotional wellness. How we relate to them, how we communicate with them, how we break news to them. I heard Sister Jele talking about having a 4-year-old child. How do you relate to that child? In our families, we have children of various ages, and children experience emotions differently than adults. Children, most of the times, especially younger ones, they don't have sufficient vocabulary even to express how they feel. So in some families, they may not even have safe space to express how they feel. So these are the things that we really need to look at it, to take into consideration, and not just, no, they're just children, no, they will understand, and how we talk about these issues when they are around. Someone mentioned, I don't know, that it was Dr. Kwinana or Buse, about how COVID-19 is always, when you talk of it, we talk about death. So can you imagine when children equate that to death, how they must be feeling inside, the intense fears that go through them as they think about this thing. How, when we look at the statistics that come in day in, we focus on how many people have died. And we don't talk much about recoveries. Whereas those are the very things that we are supposed to share with our children. That, look, the majority of people, those who can understand, that are recovering from this disease, so that they can know that it's not only about death. There are recoveries, and recoveries are way more than people who are dying. So we need to really encourage. We need to talk, to have these open conversations with our children as we go along. Okay, coming now to communicating with our children. Generally, when we communicate with our children, whether it's around coronavirus or generally, children, they have 3 languages that they understand. They have body language, it's play language, and it's your spoken language. Let me start with the spoken language because it's the one that we use it most of the time. We need to speak in simple language when we speak with children. We need to guard against using medical terms, big terms, and talk as if we're talking to adults. The nice thing about children is that they ask a lot of questions, so we all know that. And that means they lead us into what they want to know. So you must let a child lead you. You open the topic, then let her lead you, because what she or he wants to know, you will ask questions around it. So you don't bombard the child with a lot of information. You give it in small chunks, but it depends also on the age of the child. But with smaller children, we give them in small, that they can digest. And then you will see that if the child leaves, it's enough. Don't call the child back and say, we were still discussing this issue. If the child, it means I've heard enough. What I wanted to know, I know now. But we must also not rush children when we talk to them. We must take time. We must listen. Listen. I cannot ever emphasize that. We become impatient most of the times as adults, but we need to take our time to listen. And we must be honest. That's the important thing, especially if there is an infected member of the family. Be honest about it, because children, they feel when there's something wrong within the family. They will know. Be open about it and be very honest. And the other important thing is that we must not be afraid to say we don't know as well. Because children sometimes can ask direct questions and we become scared. We don't know what to say. Honestly, if you don't know, say, I don't know. For example, a child can ask, is grandfather going to die if baby has head that is infected? You must, first of all, give hope to the child. Assure the child the doctors are doing everything that they can do. That's what you tell the child first. We as the family, we are also praying about this situation. But we don't know whether grandpa will live or die. You start by assuring the child, and then you say that you don't know what's going to happen and not act as superhero. Number 2, it's important that you as an adult first, you must recognize your own feelings, how you feel before you speak with the child. I am feeling anxious about this whole thing. Why am I anxious? I have feelings of fear. what am I most fearful of? Because when you recognize your own feelings and why you feel that way, it will be easy for you to support someone else. And when you speak with the child, you first tell the child that we are all fearful of this virus, so that the child can know that she is not feeling something abnormal. It's something that daddy and mommy also feels. It's something that we all of us, we are uncertain about things, the way that they may happen. So it's very important that we share our own feelings with the child. I want to go to the body language. With the body language, we must observe the body language of the children, because that is where we are able to recognize how they really feel. As I've said before, some children may not have the vocabulary to express how they feel. We must be observant, even when we talk with them regarding these issues. Just look at the way the child is sitting, the posture, the way the child is listening to you. Look at the eyes, look at everything. Then you'll be able to assist the child to identify the feeling that this child is feeling like this. You can help the child to even identify the feeling herself or himself, because the child may not know how he or she is feeling. But when you assist them, but you will not be able to assist the child if you don't observe it through the body language. The third language is the play language. We all know that children are playful. For some kids, it will come out how they feel about it through play. This also takes time. You must have time, must sit down, you just play and then observe through play how they are feeling. As they play, you talk about it, or you listen as the child plays with his toys. What is he saying? You know, sometimes they talk. You may catch up something from there. Children need to be protected. And it is only when they feel safe that they will be able to become more resilient. Because during this pandemic, the resilience in our families will determine how resilient we are as families, will determine how we will survive currently and even after everything, if there will ever be an after, but we hope that there will be an after. There are ways that we can promote resilience in children. Number one, we must be sensitive towards children, very sensitive. We must, you know, a responsive caregiving. We are caregivers to our children. We give them food, we do that. But now it must be very responsive. In order for it to be responsive, let us remember the communication I talked about earlier. Because if we're not observant and we talk to them, we will not be able to give responsive care. Secondly, the meeting of basic needs. When we talk of basic needs, we must understand that as families, we are not on the same level when it comes to being able to meet the basic needs. For some people, it's easy to meet basic needs. But we know that there are families who are unable to meet the basic needs. But for children now in this family, an adult would understand. Let's say the family has lost its income, and now they are in a space where they are unable to meet their children's basic needs. That is when we need to support each other. we need to ensure that all families, they know where to get assistance for basic needs. As we have seen now that there are lots of NGOs that are coming up with food parcels, we must, as families, though we are not in need, but we must be informed of resources around us so that we can be able to assist other families to tap on those resources so that they can be, because children, if things change in meeting their needs, they now become more fearful. They now become more uncertain. And now, because there is this coronavirus, now our needs are not met as they used to be. And that is going to be a huge, huge deal for them. Protective factor number 4, number 3, the emotional support for children. You know, children, when there is something that they feel is not okay, they experience anxiety, same as us. They become sad. And some children will become clingy, you know, and you don't know why this child now, all of a sudden, was so much of an independent child. But now it's because she is afraid, or the child is afraid. So now will be so clingy. So you must understand that now the child needs emotional support. The last factor on protecting our children's emotional well-being or building their resilience is support for us as caregivers. You know, this period is very emotionally draining. And when you are emotionally drained, it's easy to snap. You are always tired. So it's very important that we look at our own emotional well-being, because sometimes as a caregiver, because as parents we are caregivers, there is no one who is going to care for the caregiver. So it's very important that the caregiver takes breaks. Give yourself breaks. Whatever environment you are in, you know, even 5 minutes away from the children, just to boost yourself so that you don't become fatigued. We're still going to come to the toolkit, né? For positive living. But I want to touch this, that we need to prioritize ourselves to re-energize and also to reach out for support. Reaching out to friends, talking with parents with children who are of the same age, you know, listening to videos that speak positively around this whole issue, so that as the caregivers, we also are energized, we also are able to give the responsive care to our children. Because if we don't take care of ourselves as the parents, as the caregivers, it will spill over to our children. Our emotions, they spill over to our children, and they become the mirror of how the emotional well-being of the family is. Ne? Okay. Now we're going to move back to the family structure as a whole. Yes. As I've already mentioned, that as families, the COVID-19 pandemic came to us, we're already having our own underlying emotional challenges. Now it came with its own added challenges. Now it's stretching us to the limits. Now we have to be resilient enough to bounce back. When we bounce back, you know, it is said that resilient people, they bounce back to their original form. But this afternoon, I want to say, we are not going to bounce back to our original form because we are told that it's a new normal. We are never going to go back to the original shape that we were in, whether as churches, whether as the community, and even as families. So we have to bounce back, come back. The shape may change, but we have to move on. Ne? Because the most important thing is to bounce back. Then we will have to see that the shape, we were round, there was a round shape before COVID-19, but now it comes back with a different shape. But we have to move on. So now what do we do as families? To build resilience as families is a process. We all are resilient, guys. We can never say so and so. We may differ in levels because this is a process that has some building blocks. Some may not have some building blocks towards resilience, but it is a time that we take a breather and we regroup, we reorganize ourselves as families, and we build on our emotional well-being. Because it is going to depend on how full our emotional bank is. We need to redeposit, because we cannot be taking and taking, because when it becomes empty, we will crash. And we don't want that. After everything, we want to reunite as the happy families. After everything, we want to reunite again as our neighborhoods, as our communities. It all starts in the family. We want a country that is going to bounce back. It all starts in the family. So that is why we need to deposit a lot into our family emotional bank, so that we are able to crawl. Yes, we're going to crawl. To stand up. Yes, we're going to stand up. And we want to run at the end of the day. Fine. The process of building resilience, it starts from changing basic behaviors and thought pattern. Just as individual members here in the family, we have to change our thinking pattern from how we were thinking. We must change the nature of self-talk. We must change the nature of family talk. We must guard against negative talk, especially at this time. We must avoid, I can't do this. No, this is too much, I'm giving up. We must always, we're gonna make it. Sister Jele talked about faith. It's time that we tap on our faith. And when we feel we can't do it anymore, we don't say, I can't do it, but we say, God can do it. Because as families, we are in different spaces. Some families may not have financial challenges, but some have. Some have got family violence challenges. There are a lot of different challenges, but we need that to say, God can. It's very important to maintain good relationships. I cannot overemphasize the maintenance of good relationships among families. Because if we do not have good family relations, the elasticity of the family becomes weak. And the family becomes vulnerable. And the family is at risk. So we need to build on those family relations. During the previous levels, it was a good thing to hear people talking about how much time now they spend with their families, how much time people spend with their children, how much time there is connectedness. But we know that that didn't happen to all families. There may be families out there who didn't enjoy that connectedness. But it's very important that even now, as we move to other levels where the lockdown restrictions are relaxed and we're going back to work, but we continue that connectedness, because it has proven to have worked for families to grow stronger during this lockdown. So we need that resource going forward. We need to look for opportunities of self-discovery in all this. We need to rediscover ourselves, because somehow in the business of life, maybe we have lost ourselves somehow. So we need to rediscover ourselves as individual members of the family, to rediscover ourselves as the family, what we stand for as this family, what we believe in as this family, what our values are as this family. As families, Dr. Kwinana touched at healthy eating and exercising. I'm not going to dwell on that. But I want to touch on a routine. You know, during this lockdown, we lost our usual routine as families, especially when it comes to children. Children need a routine. Routine in children, it keeps them safe. Routine helps a lot for a child's emotional well-being, because children were so used to their routine, waking up, going to school. They know playtime, they know when this happens. But we somehow lost that because it's just open time. But we need to recreate that so that children go back, even if at home, they know that from this time to this time, it's schoolwork. From this time to this time, it's play or whatever. Maintain the routine for children, because children, if they lose the routine, they can just become just emotionally vulnerable, and you may not be able to kind of take control, because you're still a parent, you still have to control the situation, control how children behave, what they do around the house, so that it also forms part of your own well-being. As we said, that as the caregiver, you also need that. So if there's no structure, you can easily break down. But if you know how the structure works, I've structured things here at home, then it becomes easy for you to handle everything that is happening here. I just want my last points. I just want to touch on some keys that we can use as families to survive. Some keys that can help our emotional well-being. Some keys that can maintain our family elasticity, so that we do not become vulnerable, we do not get carried away with everything that is happening. I'm just going to give a framework. This framework was developed for families in adversity. It has been tested, it has been tried. And this framework can work with all types of families. Whether it's an extended family however big or however small the family is, this framework can work. It's a framework that can help us, that if we tap on these keys that I'm going to share with you, they can help us to rise above the circumstances. They can help us that after everything is over, we pull through as one piece, as one unit. These keys, it's 9 keys, but they are in 3 different areas. The first area is the family belief system. The second area is family organization and resources. The third area will be family communication. I'm just going to start with the first area, broader area, which is the family belief system. There are 3 keys under it. The first one is that our belief system, whatever it is, help us to make meaning of crisis and challenge. Because our belief system is a framework where we view whatever comes our way, how we're going to handle it, how we're going to make meaning of this. For example, as Christians, or specifically as Adventists, we know that it's the end time. These things ought to happen. That is how we make meaning of such things when they come our way. These belief systems, they help us a lot, especially if it's a shared belief system within families. I understand that some families don't have a shared belief system. However, even within those families, I am sure that somehow they all believe in something bigger than themselves, as they would put it, in something bigger than themselves and something bigger than any challenge. So that's where the common ground is. The second key in family belief system is maintaining a positive outlook. Because our belief system help us to maintain a positive outlook. Because we believe that God is still in control. We believe that our faith will help us pull through. So even if there is hopelessness, because we believe in God, that in itself helps us to maintain the positive outlook in the midst of what is happening. The third one is value and spirituality. I think I've touched on this, that our values as Christians, I'm talking as a Christian, are based on our belief system. Then what do you value as this family is based on your belief system. So those shared values, it's what is going to connect us to ourselves at this level, and it connects us to God. So during this time, I am sure that as Christians and even other people of other religions, we have called on God. We have tapped on this one. And it is important that we also share, because this is a very important resource that we have as Christians. So we need to share this resource that we have as families with other people who may not have strong belief systems, so that they know that during times as this, we need something that is greater than ourselves, something that is greater than what we are faced with. I will move to the second broad area, which is family organization and resources. It has also got its own 3 keys. The first one is flexibility. I think I have mentioned that this pandemic, as we are experiencing it, as we are being stretched and stretched, when we bounce back and being stretched again, the shape or the form of our families is bound to change somehow. Therefore, we need to have flexible family structures. We cannot be saying that we do things this way. We have always done things this way. As we get information, as we learn more, as new things are being discovered, we must make the boundaries more flexible, the structure more flexible, because we have already changed how we do things, and we need to be more flexible because we need to modify how we have been doing things to fit the needs of the time. Because if we're not going to do that, we may be putting ourselves at risk. If we're not doing that, there may be tensions at home, especially for parents, because they are the ones who are responsible for a family structure. So we need to be accommodative to things that maybe we're not accommodative to before, because we have children, we've got adolescents who understand things differently than the rest of the children or something like that. So we need to be, as much as we are looking, securing our families, but we need to be flexible. This will allow us to adapt to change, because now we need to adapt to a lot of changes that are facing us. Number 2 is connectedness. I've already touched on that. I will not spend much time. We need each other. We need each other as the family, because we must count on each other. It starts here in the family before it goes out of the family. Before I am able to call someone outside the family, I need the support inside my family. Having said that, however, we still need to respect each other's individuality as much as we need each other. We must respect each other's individuality. We must respect each other's separatedness. So that, because here we are trying to build, we must not therefore unnecessarily step on each other's toes, create unnecessary tensions, because we are building our emotional well-being. We are building the resilience of the family. Then our social resources, I've also touched on that. We must know our social resources. We must know where to go to when, because these resources are there to support everyone. There is no one who doesn't need them. They are not for a specific sector of the society. They are there for everyone. So we all need to know where to go, when to go. If we don't know, we must please learn to know what is within your area, so that whatever happens, whenever, you're not like, I don't even know where to start. At least you know that I know where to go when there's an emergency. I know where to go when I need this type of support. Have that. Even the children must know where to tap in when they need support. You may not be there, or you may be in a position not being able to say, kids, this is what we want to do, or being controlled. So you need to know your community or social resources, your network, because this is a time of crisis that we need in network to support us. Finally, the third area is family communication. I have spoken on communication, but I was focusing on children then. But I'm just going to place it now, to talk about it broadly. But we know that communication is vital in everything, especially in families. Because when we don't communicate, we will not know how others are feeling. We will not know why people behave the way they do. Communication, it can never be overemphasized, the importance of communication. We must share clear and consistent messages. Communication, it must be direct, it must be clear, and it must be honest. I've already touched on honesty, even among ourselves as adults, even if it's not with the children. Honesty is important when it comes to communication. If we are open and we are honest, it kind of sets a stage of a shared process of decision making, because there are decisions families have to make. There are decisions very vital to the health of the family, the well-being of the family, that families have to make, that now we are at this space, now we're at this stage, so let's decide how are we going to deal with this. So open communication, it sets a shared process for vital decision making. How are we going to move forward in this crisis? Secondly, there must be openly expressed emotions. In this area, some people, it's not easy for them to express their emotions. It's usually said it's men who, in this area, struggle. But it's very important that we learn to share, to express our emotions. Because if we do not share our emotions, we bottle them up. Emotions have their own way of expressing themselves. We say you bottle it up, but it expresses itself in another way. You become angry. You behave differently. It's pushing, because an emotion wants to be expressed. You're not expressing it verbally, but it's going to express itself in other ways. Hence, it's important that we express these emotions verbally, because your wife or your husband or your children may not be able to really know how you are feeling until you express it. Okay. We need to work as a team. That's the third one. It's teamwork, it's teamwork, it's teamwork all the way. We need to brainstorm ideas. Ask, what do we think? What do you think? What do you think? Even if it's a child. So how can we do this differently now? We've tried this. Let's come up with a variety of possibilities. So we will never work as a team and come up with all this variety of possibilities if we do not communicate. So communication for emotional well-being, I can say, is a foundation. So that at the end of it all, we are able to come together, we are able to bounce back, we are able to move forward. Because as I've said earlier, moving forward, it's what we want. We want at the end of all this to be in one piece, to move forward, so that we can say proudly, just like Sister Jele, she's a survivor. We must all be survivors at the end of the day through our family belief system, through our family organization and resources, and family communication. I hope we have all learned something this afternoon. It may be a lot to take in, But with baby steps, some things you can never do all at once. But just one thing, start talking as a family. That's where the start is. So that you may be able, you can even assess where we are at this moment. What are this family greatest fears? What are our fears as the family? What are our challenges as the family? Just zoom into your specific family. Do assessment of your own family. And then you move from there so that children, even as they go to school, because we need to prepare them, we need to know how they feel so that by the time they go to school, they are confident. Because if we only display those fears and we all uncertainties, when children go out there to school, they won't be confident enough. And now it will show in everything they do, even in their performance in school, how they relate with other children. But they will only get confidence from our families. May the good Lord bless you as you think about these things. Amen.
Amen.
Amen. Thank you, Sister.
Amen.
You've said a mouthful. You said full. I think this was clear to everyone. There was a direction. There was a direction. I think each one had something to take. Each one had something to take from the presentation. But now, I just want us to take few minutes because the 6th of July is earmarked as a day of prayer, praying for families. I think let's take few minutes and we pray for families. We pray for families. We pray especially for all the families. We also pray for families who have experienced this coronavirus. We have gone through this. Maybe a member of a family had a coronavirus, and they were directly or indirectly affected by the coronavirus. And I know that some of the families have lost their loved ones. They have lost their own loved ones through this coronavirus. I think let's remember those families as well. As it was mentioned in the presentation, that this pandemic affects us in different ways. Let's remember families who are adversely affected by this pandemic in prayer. Sister Jele, I'm going to ask you to lead us in prayer. Shall we close our eyes as we pray?
Bawethu semazulwini, dala izulu nomhlaba nemithombo yamanzi. Nkosi yethu siyakubulela for being a loving and caring Father. Thank you, Lord, for all the providence you give us. Galomzuzu, we are remembering Nkosi yethu abantwana bakho that are in different households, Nkosi yethu, as families with different challenges, Nkosi yethu, that you know. Sithi Nkosi yethu ngalomzuzu, we ask that you visit each household, you visit each individual, Nkosi yethu, through your Holy Spirit, you strengthen those families. You become Nkosi yethu icebo, you become a solution to challenges abanazo. Nkosi yethu, your beacon of hope and your light, Nkosi yethu, be a lamp unto those houses, Nkosi yethu, that they never lose connection with you, Bawo. Ngalamaxesha Nkosi yethu okugqibela xa kubonakala umtyholi Nkosi yethu efuna usahlula, nawe Nkosi yethu efuna usiphelisela ngamathemba, Sibeka Nkosi yethu ii-families zelizwelonke Nkosi yethu esandleni sakho, sisithi bawo abantwana bakho mabaphumele ngaphaya Nkosi yethu besathi umkhulu wena ufanele ukubongwa ngamaxesha onke Nkosi yethu. Siphume nendumiso apha Nkosi yethu despite the challenges that ongendawo asifaka kuzo. Some families Nkosi yethu have lost abantu Nkosi yethu ngokusweleka Nkosi yethu mhlawumbi ngenxa yale pandemic yale coronavirus Nkosi yethu. Some people Nkosi yethu abaswelekileyo in those families were even breadwinners and sole providers Nkosi yethu. Kushiyeke kubanda kulo makhaya Nkosi yethu, akukho themba. Kodwa Nkosi yethu ngenxa yento yoba wena sisazi into yoba unguThixo owayesoloko ekho Nkosi yethu oyi-provider, you will be a solution Nkosi yethu necebo Nkosi yethu. Kodwa Nkosi yethu kuyo yonke into eyenzekayo ke bawo sicela abantu bakho Nkosi yethu babambelele kuwe. Khawusongezelela ukholo ngeli xesha le-doubt, khawusongezelela ithemba ngeli xesha Nkosi yethu kubonakala siphelelwa ngamacebo. Usengezelele Nkosi yethu ukuqiniseka kuwe Nkosi yethu xa sibonakala Nkosi yethu sinezirhulumente ke bawo eziphatha ziyeka bawo. Khawusomeleze ke Nkosi yethu size ezi families Nkosi yethu sonke Nkosi yethu kwizwe lonke Nkosi yethu liphela. Nkosi yethu sithetha ngee-families bawo, kukho abantu Nkosi yethu abangenazo nezo families bawo. Sithi Nkosi yethu ngenxa yento yoba wena you are a father, you are a friend Nkosi yethu, sicela ke bawo babazi abantwana bakho uba banoThixo nguwe Nkosi yethu oyifemeli Nkosi yethu, ngoba sinekhaya Nkosi yethu silungiselela uya kulo ngemini. Siyakubulela ke Nkosi yethu ngamandla osinika wona Nkosi yethu. Kwanga Nkosi yethu nale session Nkosi yethu speaks to your children Nkosi yethu ngendlela Nkosi yethu that you had intended. Ukuze ke Nkosi yethu yenze Nkosi yethu okunqwenelwa nguwe. Siyakubulela ke bawo ngenxa yento yoba siyazi into yoba izinto zonke sizifumana kuwe. Konke ke bawo sicela ngenxa kaYesu Kristu umfeli nomvukeli wethu. Amen.
Amen.
Amen. Thank you, Sister Jele, for taking us into the throne of grace through prayer. I want us to look at one, maybe three questions. We just assist local churches. I've noticed in Sister Gomo's presentation that she made mention that this pandemic affects families in different ways. It affects different ways. And I was also listening to Sister Jele's prayer, also alluding to the fact that there could be families who have lost breadwinners. And now those families are left stranded. Now, how can we advise, counsel local churches in the event that there is a family that is adversely affected by this pandemic? As a result, they can't meet, I think Sister Gomo mentioned that we've got to meet basic needs. How that family can meet the basic needs. They can meet the basic needs. And I'm asking this question in the view that we are brothers and sisters, each other's keeper. How can we assist? What is it that a local church can do? I think we need also look at the ways of identifying such families. How can they identify, and what is it that they can do to assist families who have been adversely affected by this pandemic, especially in the economic way? Anyone can respond to this one. Anyone can respond to this one.
Okay, Mfundisi, if I can start. I think we are our brother's keepers.
Yes.
As the church. And I want to believe that as local churches, as Christians, as Adventists, we have always we're supposed to be looking after our brothers. You mentioned identifying these families, number one.
Yes.
And then because before we can help them, we have to identify them.
Yes.
That brings us to the issue of connectedness. Are we keeping in touch with each other? We live in a time of technology. It's not difficult to keep in touch with each other, because it may not be easy for me to just say it to the church WhatsApp group, if there's a church WhatsApp group, that I'm going through this. But if there are people who are checking up on me, so it's very important that we check up on each other so that we can know which space we are in during this time as the different families. I don't want to place that on leaders, but all of us as members, I guess more so as leaders. And I should think that in terms of the basic needs that we're talking about, we must be the first point of call. Because if I am hungry now, to connect me with a community organization, that can take time. But as the church, we must be the first point of call.
Yes.
That what do we do now before we can link the person to the various community resources that can support that specific family. So I think I cannot really prescribe that how church may do it, but I think that churches, they know how they can do it, because various churches have got their own cultures of doing things. Some Dorcas societies are active in some churches. They know that we'll tap on this resource. Some churches are able to say, okay, let's collect money now because we need to help there. Or maybe a certain group of people that, no, let's do this now. There is this touch sister band and sister band, or whatever way. So there are various ways that we can be able as local to be the first point of call. I think that would assist.
Yes. In other words, there should be no family that is going rough time when other families are still around.
Yes.
Be our brother's keeper. Is there anyone who would like to add on this?
Also, I would like to add on the emotional aspects, especially surrounding loss during this time.
Yes.
For example, in our church, we've lost 2 members during this lockdown, meaning that we are not able to go and conduct prayers as we would normally do.
Exactly.
We can't all go attend the funeral. It's not easy to the family, it's not easy to us people who cannot support when we want to go and support. But staying in touch and just messaging and calling and just checking up on them and letting them know that you care and that you are praying with them. But also maybe it needs us to start thinking now of what are we planning to do out of the lockdown to those families. For example, yes, we couldn't go, yes, they have buried, they have finished, but what are we planning to do to show that we care? Maybe an itinerary to say we need to go visit those families. They need to know that we care. You know, there's a lot happening around emotionally for everyone. And I was just thinking about it the other day, that in the event that churches do eventually, we are able to go back to our church buildings after the lockdowns, that it would be the first service will definitely be a very emotional service for everyone, for all of us. Not only because we will be excited that we are seeing each other, but at the same time, we are not all here, because some of us, we have lost but at the same time happy because God has kept us. We are here. So it's just going to be a mixed feeling. And I was thinking that we need to keep each other in mind, that it's not easy for everyone.
Telling you. Thank you, Sister Jele. Thank you, Sister Jele. Another area which I think it's very important. It just came across my mind that during this lockdown, we have elderly people who stay alone. We have elderly people, they stay alone. Normally, once a week, they come to church and they mingle with but during the lockdown, even that chance of meeting with people, it's not there. They suffer alone. They suffer alone in their corners over there. What is it that we can do for elderly people, especially those who stay alone? I think from the Sister Gomo's presentation, she mentioned that there is anxiety, and that anxiety is found among elderly people as well. But them, they are not like me. I stay with my family. These elderly people, they stay alone. What is it that we can do to minister to these elderly people?
You know, just to share our experience in our local church, drawing up a call list and just, you know, calling from time to time, saying that, okay, this week we are calling up this particular family or this particular mama, you know, just, I've found that it has been so nice to them over just elder hey has phoned through or Deacon has phoned through and even pray with them, say, no, this is time, you know, after chatting, let's just pray together. Offer an opportunity and also you pray. And then move off to somebody else. You don't want, does not need to even spend that much of a time. You know, just this week, you can say this week is this particular family, this particular person. And again, airtime, you buy an airtime of, get an airtime of 20 rands. You say that now, next week it's so-and-so, that other week it's so-and-so. It does have an impact, cool. But especially when we were still on level 5, you know, and it made a big difference. Just that they know that, look, we are not alone.
I like that idea of from time to time we buy them airtime data, because some of them cannot afford this. When they have data, then it means they can connect with the church. If a church meets on Zoom, we assist them as well to meet with the church family on Zoom. At least that will do something when they are able to meet with church family, maybe on WhatsApp, when we circulate these sermons, short sermon on WhatsApp, they also receive those short sermons on WhatsApp. I like that idea. I like that. Is there anyone would like to add on this?
The other thing, Fundisa, that I think can help, which is maybe more of a practical thing, especially now that we are the lockdown restrictions are being are more flexible.
Yes.
Especially when you stay in an area with your fellow church member who's elderly, who's close by, whereby you could even drop something without going into the house, because you know we have to protect them.
Yes.
You could
Yes.
just bring fruit, just drop it. You call the person, you tell the person, you know, it's old ladies, even if I have baked something, at home, because as we are sitting at home, we bake, we try all these kind of things. If I've baked scones, take some of the scones. When I drive by her house or their house, I just drop something. I think that can make them feel special and have that sense of connectedness, that there are people who still care for us, there are people who still think about us.
Thank you very much for this. I'm sure the church, the local churches will use these advices so that at the end of the day, let everyone say the bigger family, the church family, was there for us. I think that is very important. During this difficult time, we support one another. We support one.
Can I just chip in, Jemfundisi?
Yes, Doc.
Hey, I just want to share with everyone, my experiences during this lockdown. Perhaps they may be of help to the church and also to other people generally. There was a mention from Sister Komo's talk of self-discovery. Yes. During this lockdown period, I had a self-discovery. I took time, get on YouTube. I learned, I never knew that I had a skill of baking. I never knew that I had a skill of knitting.
All right. All right.
I'll take, and we can build a skill base so that we can start. I just felt that we are going to start a group of church members. Do something so that people, they don't depend on handouts.
Yes.
All of a sudden we can start saying that, what can you do? We teach each other, some new skills that we have learned perhaps during lockdown period, so that we can be able to stand on their own. Sister Komo is making mention of baking. People can all of a sudden start baking scones.
Yes.
Things that we learned during our lockdown. Then, they start their own small businesses around in the villages, around in the townships, around in the suburbs, And, they say from coronavirus era, this is something that came out that's positive. And they start businesses.
Amen.
Yeah.
Amen.
Beautiful.
Thank you, Doc. Thank you, Doc. Sister Gomo, can you assist us on this one? Can you assist us on this one? You mentioned that this pandemic will definitely affect us adversely emotionally. It will affect families, it will affect individuals emotionally in a negative way. Where can someone, after maybe during this or after this, so that one may close a chapter and begin a new chapter, where can someone go?
Okay. As I have already mentioned before, that there are a lot of community resources that can help people.
Okay.
You will find that there are social workers in our areas.
Yes.
There are government social workers that you find in hospitals, but you cannot just go there because they are overloaded with having to deal with patients inside the hospital. So I cannot just from home go to a social worker in hospital because they are mainly there for the patients in hospital. But you will find that there are social workers in social development, for example.
Yes.
But we understand that, we must understand that, because I hear a lot of people complain a lot about social workers in government. They don't understand the amount of workload that those social workers have, especially during this time, because the government is busy And social workers in the department may not have the time to sit down with individuals because they have to be out there in the communities. There are campaigns, there is this, there are response teams, they are very busy, but there are a resource that is there. I'm not saying people must not go there, but I want people to make use of NGOs in our community.
Yes.
Because that is where they will get counseling.
Yes.
Free of charge. Let's start there. We have FAMSAs,
Yes.
we have a range of NGOs. We have CMR, I'm thinking of around East London. We have FAMSA, we have CMR, we have, a person may hear that, oh, it's child welfare, therefore I'm not a child. Please go there if it's what is close to you. You go to the one that is close to you. In these days, there are various NPOs around us. Yes, if there are trained counselors there, you must go and you will get the help that you need. There are psychologists out there that have private practices. You have your medical aid, you are able to pay, make an appointment to see a psychologist. And you can be able to get the necessary help that you need. Sometimes it may happen that a person may not know where to find these people. As I've mentioned, for example, you can go, because everyone would know social development officers.
Yes.
Go there, ask. They have the resources.
Yes.
If you go there, you ask that, I need a list of NGOs around here.
Yes.
Because they won't have time to attend for you because they have a lot going on for them. But if they can, they will attend. But if they say maybe, no, we'll wait to put you through a waiting list, can I get a list of NGOs around my area so that I can go and get help there? Can I get a list of psychologists around my area so that I may be able to go there? So that will be an easier way to get which resource is around you.
Thank you very much, Sister Gomo, for this explanation. At least now we know where to go. That mentality we normally have, that this thing will just vanish, will evaporate, will just go. It's not helping. It's very important that we seek help so that we are able to close a chapter and we start a new chapter. I think that is very important, and now we know exactly where to go. I'm sure we can take the whole day discussing this matter. It can take us all day, but I think let us end here. Let us end here. Probably sometime in the future, we may have this topic again. We continue with it because we cannot exhaust it. We cannot exhaust it, but the information that was given today, I think it is sufficient. I think it is sufficient for today. May the good Lord bless you. I want to say thank you to the presenters, Sister Gomo, Dr. Kwinana, Sister Jele, for the presentations, the input. I'm sure now even our church members are fired up. There is hope that even during this pandemic, and we can still go on, we can still hope. Our God is still there. Our God is still there. Thank you very much. At this time, we are going to ask Dr. Kwinana to lead us in prayer. That is a closing prayer.
Okay. Masithobeni inhloko namehlo. Enkosi bawo ngoba nguThixo onguye onothando. Thank you for this program that you prepared to strengthen our families during this crisis time. Bless all of us and keep us in the bosom of your heart during this COVID-19 period. Bless everyone who was listening and bless the leaders that prepared this meeting. All this, we thank you in the name of our Lord and Savior, Jesus Christ. Amen.
Amen. Amen. Once more, I thank you, all of you. May the good God bless you. Thank you very much.
Thank you, Mfundisi.
Bye-bye,
Thank
bye-bye.
you.
Bye-bye. Bye-bye, everyone.
Bye.